All right, responding to a chest pain call at Weaver State University, 30-year-old male, complaining of chest pain and shortness of breath.
Okay, I've got my BSI. Is this thing safe?
Yes.
Okay, nature of illness is chest pain. I'm going to consider additional resources. I'm going to activate ALS because it does look like a critical patient. I've got one patient. I'm going to be concerned about cervical spine, and this doesn't appear to be a trauma, so I'm going to rule out cervical spine. Hey, sir, my name's Joel. I'm with EMS. Is it all right if we take care of you?
Yes.
Okay, I'm going to get a general impression of this patient. He does appear to be in his 30s. He is having difficulty breathing and having chest pain. I am going to get a chief complaint. So, sir, what's going on?
I just had this bad chest pain that started about a half hour ago, and it's just not getting any better, it's worse.
Okay, I'm looking for any life threats. I'm going to assess his level of consciousness with the ABP U scale. He seems to be alert. And I could assess his orientation with person, place, time, and event. Now I'm going to assess his airway. Sir, can you open your mouth? Are you having any difficulty breathing?
Just that pressure in the chest is hard.
Just in your chest. Why don't you take a deep breath for me? The airway seems to be patent. Breathing seems to be normal. And do you feel like you can take a breath okay? Okay, I'm going to give him some oxygen. I'm going to use 15 liters a minute with a non-rebreather mask. And I'm going to assess the circulation. Got a radial pulse, seems to be regular and strong. I'm looking for any severe bleeding. It happens to be trauma. I'm checking his skin characteristics, color, temperature, and condition. Seems to be pink, dry, and warm. I'm going to assess capillary refill. And I'm going to do a focused assessment now on the pain that you're having. So, sir, tell me what's going on.
I've just been working here up at my desk, doing some computer work, and my chest has started to hurt a little bit. Just had lunch probably about an hour ago, and I thought maybe it's just a little indigestion, but I've had this before. It's not this bad, but it's pretty intense pain in my chest.
Okay, so this patient's going to be a rapid transport, so we're going to go ahead and transport him. And en route, I'm going to do an OPQRST. So what was the onset? Tell me again.
Again, it's about a half hour prior to getting here, and it was just pretty intense pressure.
Okay, anything make it feel better or worse?
Not really. This oxygen is a little bit better for breathing, but the pain's still there.
Pains in your chest, does it radiate anywhere?
A little bit up in this left shoulder.
Okay, on a scale from 1 to 10, how severe would you say it is?
Probably about a 7 or an 8 at this point.
And how long has this been going on?
About a half hour, 45 minutes now.
Okay, well, I'm going to go ahead and take some vitals, and then we're going to see if we can call medical control and maybe help you out with some medication. Okay? Are you allergic to anything?
Just bee stings, no medications or anything.
Are you taking any medications?
I have nitroglycerin. My doctor prescribed me about 2 or 3 weeks ago.
Okay. Have you taken any of that yet?
I did after about 10 minutes of having the pain. I took it, and it hasn't helped a whole lot at all.
Okay. Let's go ahead and put this on your arm here. I'm going to check your blood pressure. Any pertinent medical history that I need to know about?
Just this chest pain, no heart attack or anything like that. Nothing else.
When's the last time you ate?
About an hour, a little over an hour ago.
Okay. And tell me again the events that led up to this.
I was just working at my desk. I wasn't up and around running or anything. Exercise, I was just sitting.
Blood pressure is 110/70. pulse is 70. Respirations are 18. I'm going to check his pupils. Checking pupils for pearl. Seems to be equal, round, regular in size, and reactive to light. I'm going to go ahead and listen to your lung sounds. Okay, I'm going to go ahead and take a blood sugar on you. Blood sugar's at 80. Okay, now I'm going to help you with your medication. Your blood pressure is above 100 millimeters of mercury, so I think we're going to be able to give you another dose. It's been within 5 minutes, or longer than 5 minutes since you've taken your previous one. And so I'm going to call medical control and see if I can help you out with that. Okay, before I call medical control, I'm going to go through my 6 R's. Let's see this medication. So what's your name?
Paul.
So I have the right patient, so I'm looking at the right medication, so we do have nitroglycerin. I'm going to looking at for the right dose, and one nitroglycerin every 5 minutes. Right route is going to be sublingual. Right time, which we're at the right time, and we're going to do documentation. So I'm going to contact medical control. Medical control, this is EMS or EMT Joel Bass. In Unit 1, we're on the scene with a patient that has chest pain, and his vitals are 110/70 with a pulse of 70 and respirations at 18. He has taken nitroglycerin longer than 5 minutes ago. His systolic blood pressure is adequate, and I'd like to have permission to assist him with nitroglycerin and baby aspirin. And so permission's granted. So are you allergic to baby aspirin? So I'm going to give you 4 of these. I want you to chew these up and chew those up real good and let them sit in your mouth just for a minute and then swallow them. And then I'm going to give you some nitroglycerin. Put that underneath your tongue and just let that set underneath your tongue. And then I'm going to reassess his blood pressure after 2 minutes to make sure it doesn't get below 100 millimeters of mercury. I'm going to do a reassessment on vitals. So what are my vitals at this time?
The pressure 120/76.
Okay, pulse.
Pulse is at 75 or 76.
Okay, I'm going to reassess my pupils. Are they normal? And chest or lung sounds.
It's still equal.
Okay, I need to reassess my primary assessment. My airway's good. Respirations are good. Circulation's good. I seem to have good capillary refill. And I'm going to contact medical control. This is Unit 1. We're en route with a patient. We assisted with nitroglycerin. He seems to be tolerating well. His vitals are relatively normal and will arrive in several minutes.